most of it is just being more complicated.
Y'all ready for this?
Yes.
Well, if you've been to any of these talks before, you probably will recognize a lot of the slides. Because I basically took some talks that we've had in the past and combined them. So there's several slides, and I'm not going to dwell on any one of them. The basic premise behind the talk will be pretty self-evident as we slip through the slides. And I want to kind of slide through those, no pun intended, as quick as we can, and then leave some time for you guys to ask questions if you have those. This does not address anything in particular, so items such as hypertension, congestive heart failure, arrhythmias, that type of thing, it's not going to go into any detail on any of that. This talk basically just is a heart talk because February is always designated as American Heart Month, and the American Heart Association pushes that item pretty heavily, obviously, for good reason. But this being Heart Month is the reason we picked heart as our talk for today. And again, I hope this isn't too boring, but if there's anything that you guys have questions on as we slip through these, just please don't hesitate to stop. So, the big deal with heart is that there are more people with heart disease in the United States than any of the other diseases that we have or maladies that we deal with on a day-to-day basis. Claims more lives than all forms of cancer, strikes on the average in the 50s in men, but can be anywhere, and in the 60s in women. Y'all have any idea why that's the case? Because of women's estrogen, they have an additional factor that helps them manage their cholesterol and triglycerides internally. So women usually don't have problems until their 60s. Not that they can't in other times, but it's mainly because of estrogen. Once menopause goes by, though, they pretty much equal the men as far as their risk factors go. So there's the biggie at the top, of that AGE thing that we can't do anything about. Genetics, also nothing you can do about that. Your anatomy, your gender, male or female, your ethnicity, whether you use alcohol or not, whether you're diabetic, how much physical activity you have. And I think I put this slide together at one time partially because the left side of the slide I wanted to, except for the alcohol part, I wanted to say that those are things that we have very little effect or control of. The things on the right-hand side, though, we do have some control of. So the things we can control, we want to do our best to control those. Things we can't control, we're going to have to just scratch those off and just say we need to do better on the right-hand side of that slide. So I would push alcohol over to that other side too, because that is definitely under our control. So even though it's one of the worst, it is one of the most preventable. And these items that are on the slide here, I'm not going to read that to you, are the things that we all recommend as far as heart health is concerned for all of our patients. I don't know if, is there anybody here that does CPR classes? The basic CPR? I know they do them in Booker, but I don't know if we do them in Perryton. Anybody taking a basic CPR class in Perryton in recent past?
I didn't pass.
Did you?
Good company.
Where did you get it in Booker?
It's through the ambulance service. Choose your parents wisely.
Sure.
Okay, here's the inside of a heart and the outside of a heart, just so that you know. The inside of the heart, if you look on there, you can see some of the blood vessels, of course, but the different chambers that you can see in the heart, top chambers and the bottom chambers. are separated by the valves in between them. And the valve, I think, is it big enough there that you can see? Can you read that from back there in the back at all? The letter's pretty small. So you can see what we're looking at when we do an echocardiogram here. You can see that you're looking at some of those valves and how they open and close. Whether they open completely, or if they're not opening like they should, like we found with Judy's heart. We also are looking at the walls of the muscle in the heart to see if the walls are moving correctly, whether they're compressing and forcing the blood out of the heart like it's supposed to when you do those echocardiograms. So that's basically what we're looking at is the inside when we do an echocardiogram. The outside of the heart, there is just a place there to try and give you an idea of where some of the parts are that we talk about. I know we throw a lot of terminology at you, and one thing I would tell you is if your doctor's talking over your head, tell him to whoa. Put that in layman's terms so I can understand what you're talking about. It's a pretty well-known fact that probably about 40 to 60% of what we talk about with patients, they don't even understand the terminology. And about 50% of what they do understand, they forget before they get to the car in the parking lot. So it's really important that you ask questions when you're at your doctor's office visit. If he's saying something you don't understand, then ask him to rephrase that. Put that in layman's terms. Talk to me like I don't know anything. But that's important. You need to be aware of what's going on with you. So heart muscle is a little bit different than other muscles. The fibers are a little shorter and more compact. And each muscle fiber has its own nerve supply. Each fiber contracts with every heartbeat. I thought that was an interesting factoid there. I don't know if you'll get that on Trivial Pursuit if you ever play that or not. So your heart's busy, it's active. Very busy. We had a cardiologist when I was in training who was very overweight, didn't take care of himself, he even smoked. And so the students were all kind of looking at him like, you're kidding me. And he said, well, I believe that we're born with so many beats. And if I use those beats up too quick, that I might die too soon. So he said, my theory is that I'm just going to kind of lollygag along and save all those beats so I can live a little bit longer. Obviously, he was being facetious, but your heart's a muscle and it needs exercise. If you don't exercise it, it's like any other muscle. It will waste and atrophy. Heart requires oxygen, activity, and the correct nutrients. So good lung health is important. There's a lot of air that goes through your lungs every day and every year. This is way too little, I'll bet you. At the base, because it's the most important, is to eat a heart-healthy diet. And I don't know if we ever have any handouts or anything on this, but I think I've got a slide in here for places that you can get online if you'd like to. And all this information would be basically on those websites.
And not to interrupt, but if anybody would like this PowerPoint, if you'll let me know, I'd be happy to send that to you or print that out and give it to you. So just let me know if you'd like to take the PowerPoint home.
Sure. I won't hold you on that. Activity is important. It's necessary for muscles to maintain fitness. The biggest reason you see the onset of heart disease in our 50s and 60s is because after high school or college, we all become a little less active. We're all busy raising families, we're all busy working, and so on. So it is very typical for us to become a little more sedentary and not maintain that active lifestyle that we should. As you all have probably figured out, the older we get, the harder it is to go back and resume that activity level and try to maintain that fitness. So it's super important to do what you can, start early and continue to do that. Make sure that activity is a part of your day, just like combing your hair or brushing your teeth. physical activity has a lot of things going for it. It decreases the chances of dementia, hip fractures, depression, breast cancer, colon cancer, type 2 diabetes, cardiovascular disease, and all-cause mortality by 30%. So activity is really very important. However, you think a minute goes by really fast, you've never been on a treadmill. So nutrition, again, that was the base of our whole, that stair-step slide that you saw. So our nutrition is our most important part. Don't put things in our system that our system doesn't like or doesn't need, or that creates or causes our problem. I ask the high school kids a lot of times when we're doing workouts, do you put gas in your gas tank or do you put water in your gas tank? And how well does your car run if you use one or the other? You need to think of your body as on that same level. If you put the right fuel in, the body or the car will respond. The wrong type of fuel in your car is not going to respond as well. So your fuel is super important. And that's where our diet, our foods come in. Everybody's seen this food pyramid in the past. If you want to read that, you'll have to get the slides from Lindsay. Lindsay's a super resource. Y'all take advantage of her. She really does a great job in preparing all these slides and doing all this for us. This has nothing to do with me. She's the one that put all this together. This one I thought was kind of cute. That sounds like most of us actually. All right. So all things in moderation, I think, is a great way to kind of consider our diet or our activity or anything we do. Honestly, I think taking all things in moderation is important. But moderation doesn't mean to minimize either. It means that we need to be doing those things, but do them at a moderate level. Sodium is the big, bad, and ugly. I don't know if we have the slide in here or not, but the meal that you ate probably has the daily requirement of sodium that you need, unfortunately, so you can't have anything else today. The fats part there, you want those fats that are liquid at room temperature. So, and also look for the item that says trans fats when you're picking items up at the grocery store. So that's a label thing that you need to be looking at. Look for trans fats. Those are the worst. Plain water, 8 glasses a day. Whole grains, 6 to 11 servings. That's about 4 cups. Fruits, 2 cups. Vegetables, 2.5 cups. 2.5. Lean protein, 2 to 3 servings. Low fat dairy, 2 to 3 servings. And fats are down in the bottom corner there, and those should be those fats that are liquid at room temperature. Here's a little deal of heart healthy foods. I looked up this Akron squash, and I think that was actually a misspelling. I think that's acorn. I never could find Akron squash. Only grown in Ohio. Here's your sodium requirement, 1,500 milligrams. The United States is one of the countries in the world that allows food manufacturers to use sodium because it's cheap. And they utilize sodium as a preservative so that the foods that we buy at the grocery store are still fresh. I think Norway is one of the countries that will not allow sodium to be used as a preservative in their foods. And interestingly enough, they have about half the heart disease that the United States has. Oh, there's your sandwich. I don't want to depress you. Pepperoni pizza is a favorite, one of mine to use as an example. for a lot of reasons, because it has almost half of your daily requirement of sodium in one slice of pizza. Anybody go to the Pizza Hut last night to the Monty Woodward feed?
Too much.
I did too, and I had 3 slices. One pepperoni, but I had probably too much sodium. Y'all have heard of the DASH diet. It's actually named after a product called Mrs. Dash, and Mr. Dash is, I think, is still produced. Mrs. Dash comes in all these different flavors, and it has no sodium in it, and it can be used as a salt substitute. And we do sell that here at United, I know, and probably at Lowe's. I don't know that for sure, but I have seen it at United. And they come in enough flavors that you can use them for just about anything. All right, so what else can we do? Leaner cuts of meat. As you can read there, eat your vegetables. It's a good thing your parents beat that into you, isn't it? Your fruits, oops. Fresh or dry, whole grains, 1 to 2 pieces per day. A slice of bread has 200 milligrams of sodium in it, just since we did dwell on the sandwich picture back there. And if you want to look up a good heart-healthy diet, you can look up the Mediterranean diet. It's online. Okay, seniors, here we go. Here's the myths. I love these. I think these are really good. There's no point. I am anyway going to get old. Exercise and strength training helps you look and feel younger and stay active longer. Regular exercise helps you lower your risk of various conditions, such as Alzheimer's, dementia, heart disease, diabetes, and obesity. They should rest. I'm not going to ask for a show of hands on that. However, research shows that sedentary lifestyle is unhealthy and that inactivity causes seniors to lose their ability to do things on their own, so you lose your independence, and that can lead to more problems, more health issues, hospitalizations and such. Exercise puts me at risk of falling down. And that's not untrue, but regular exercise actually improves your strength and balance and will actually decrease your risk of falling. I'm disabled. I can't exercise sitting down. And in fact, there are a lot of exercise tools that you can utilize, even sitting, that can improve your heart health. So I think it's super important that we take our medications that you get from your physician, go to your doctor appointments on a regular basis, monitor symptoms and weight on a daily basis, and address those things sooner than later. Monitor eating and drinking habits, exercise and stay active according to the doctor that you see, and you limit your alcohol, caffeine, and tobacco use. 7 days in a week. Sunday isn't one of them. Here's the resources I was talking about, which you can probably Google up real easily. American Heart Association, Heart Foundation, and Mayo Clinic. I would say any of those would be good. I wouldn't go to Bob's blog about heart disease or something along that line, because don't tell them what you read there. Questions? I'll let you plenty of time. I hope I didn't go through that too quick, but I know that a lot of that's information that you probably have all seen before, read before, maybe been hammered at by your doctor before, and maybe little by little, you know, if we keep hammering some of it, it'll stick. That's basically the whole idea behind it. But general health is very, very important, and it's very important to recognize that most of the issues and most of the health problems that we have, we actually do to ourselves. It's because of what we eat or because of what we don't do in taking care of ourselves. So pay attention to what you're putting in your mouth, and pay attention to what your body's telling you, and make sure that you maintain an active lifestyle. Anybody have any specific questions about anything, any concerns? Yes, ma'am.
I'd like to ask about the sodium level.
Mm-hmm.
I was told that mine was low
Okay.
and that I needed to increase it. And I don't wanna just start eating potato chips every day. So is there anything you can do to elevate your sodium level to a normal?
You could, now some people will actually do what their doctor tells them and not ever eat any sodium. And they can get low on sodium, or they may drink more water in the course of the day and dilute the sodium they have out. So even though we harp on drinking a lot of water all the time, and that is important, sometimes that may be the issue. So you might at least visit with your physician about that one point. And you could, if need be, add some sodium to your diet. Is your blood pressure running okay? Okay. No issues with being lightheaded or dizzy or fainty?
I might be something.
So the other question is, are you having any confusion or any difficulty making decisions or choices? And the fact that you said you didn't know. Caught you in that. So you can, sometimes it's okay if you know that your sodium runs low and you have ruled out other reasons, because there are some conditions where the kidney actually loses too much sodium. So we will do a test occasionally, a urinary sodium level, and see what that comes out like. If it's too high, then it could be a kidney condition or an effect of one of the medications that you take. Some diuretics lose potassium, and some diuretics cause you to lose sodium. So it may be a need for a change in medication, or you may actually be one of those people that needs to add a little sodium to their diet in some manner, either through Gatorade Zero or Powerade Zero, something along
Gatorade was
that line.
recommended, but I don't like Gatorade.
Okay.
Stand taste.
Pedialyte is another option. It's an electrolyte drink, but to me it doesn't taste as good as Gatorade does. And if you're going to pick a Gatorade or a Powerade, you want to use one of the ones that doesn't have a lot of sugar in it. Plain Gatorade, if you get a jug of plain Gatorades, it has just as much sugar as a Coke. Plain Coke. So you get Gatorade G2. I think there's now a Gatorade G0 or a Gatorade Zero, and I know there's a Powerade Zero. Those don't have the sugar, but they do have the electrolytes in it. Now you wouldn't want to drink that all the time, but 1 bottle of that to 3 bottles of water in the course of the day would be the right ratio. Does that help some? Okay. Maybe give you some questions you can ask, just to make sure you know why that sodium is there. Okay. Anybody else?
When Barbara had her heart attack, they told, her cardiac doctor told her to quit that, drinking so much water, just so many glasses a day. Why?
So in order to get rid of that water that you drink every day, your heart has to pump the blood through the kidneys, and the kidneys have to then filter that accordingly and get rid of the excess fluid. If the heart attack was severe enough that it was creating a more taxing effort for the heart muscle, he may have asked her to back off on the fluids in order to keep that from occurring.
He told her to cut back on the water consumption. He
But
didn't
that
know
should,
why.
I would think that would be short term.
Oh, really?
But again, that's a follow-up question that needs to be asked when she goes back for follow-up care. Do I continue to limit my water intake or not?
And on fats, you can cook with liquid fats, like olive oil and
If it's
whatever
liquid, it brings temperature.
stuff.
Right.
But like Crisco and of course lard, those are the ones you don't want to have.
Those are the ones that, people still use that, and if you go out to eat anywhere, that's probably what they're using, because they're less expensive. But if you're cooking at home, yes, you should use the fats or cooking oils that are liquid at room temperature. And I don't know that there's always been kind of the fad that olive oil is better, better than canola oil, and it just depends on what you read. But truthfully, any of those would be fine. Any other questions?
Well, I don't believe it. You could drink 8 glasses in a day. I tried that. I just can't do it.
There better be a faucet in the bathroom if you do
Stay there.
that. Because you'll be there all day.
I did 4 glasses a day. I drink less than 1.
Well, it is not easy, and I would be willing to bet that hardly anybody drinks 8 glasses of water a day. There are a few, but they have to work up to that. If you start right off with 8 glasses a day, yeah, it's gonna be, your body's not gonna know what to do with that, so it is something you can adjust to, and it is very helpful.
In the heat of the summer, you might drink a little more, but
Yes.
My problem, Ricky, is during the day when I'm busy, I'm always doing something else and I don't think about drinking water.
well, that's a lot.
So I drink most of my water after I get home.
At night. So then you've really loaded up.
Yeah.
Yeah.
You're in your bathroom all night.
Yes.
And I think it's just, to me, it's just a habit. I keep a bottle of water on my desktop all the time. Not that that always works either, but it's just something that you just have to work at. And
It's funny, if I'm working on the computer doing reports, but if I'm on a conference call, I go get me a bottle of water. Why I can't do it when I'm doing both of them?
Yeah,
Doesn't make it work for me.
just habits. Yeah, just creating good habits, getting rid of the old bad ones as best you can.
But
That, you're not alone.
any particular pain or anything that you're gonna feel or anything that's gonna, let you know that's heart trouble?
Well, most of the time, now you ladies don't always play fair very much, but for women, it can be GI distress, so it can be upset stomach. So you always have to take that into consideration, and that's not just women. Men sometimes will do that as well. But any upper abdominal discomfort into the chest, left or right, doesn't matter, because your brain interprets what it's feeling, and what the brain's telling you it's feeling is what you're going to express to the physician when you go in. Your heart may be wired a little bit different, and so your brain may be telling you you're having pain on the right side. Well, that's not where my heart is, but that still could be. So I think any chest pain is concerning. Typically, we look for pressure or like somebody sitting on you, and not necessarily something sharp like a knife or a cut, typically. But again, I think any chest pain is well worth talking about it at the very least, and delving into more deeply depending on how the story turns out. Does that help a little bit? Make sense? So pressure or feeling like somebody's sitting on you. You've all have probably heard of the elephant sitting on my chest. And I don't want you to, I don't know how many people in here have the experience of having an elephant sitting on their chest, but so I don't know how you would know what that felt like other than just a lot of pressure. So it's not always just sharp, stabby pain. It may just be pressure and not, and it depends on, I would bet Art doesn't really feel pain as well as the rest of us do. I've seen him with
No, I never
injury.
do.
He doesn't hurt. Yeah, he just goes on about his business. He's got things to do, so he doesn't give in to that kind of stuff. He doesn't have time. And that's pretty typical of men. They'll show up when it's way too late. How long have you been working? Well, I did it this morning.
It can also happen with women not knowing, because I never knew that my heart was an ache there. People ask me,
Okay.
do you feel it? No.
And that may not give you pain typically. It may just make you feel a little lightheaded or feel a little funny at that
And
time.
like I said, we told other doctors that of all the problems I have, some of the symptoms are the same for some of the rest of them too. And I don't ever know what's happening.
Right. So I think if there's concern, you just need to get it checked out.
I had kind of a hard time breathing, in other words. Like that
Short
elbow.
breath. And you don't have much exercise tolerance. I get up to walk to the bathroom and I'm out of breath. Or I've started having some swelling in my feet or ankles that I haven't had before. Those can be some signs or symptoms that are there because the heart's struggling a little bit. It may not be a heart attack, but it may be a heart issue. Yes, ma'am.
When I had my heart attack, I felt the heaviness, but I also had severe sweating, almost like menopause sweating. And I didn't actually know I was having a heart attack until I went to see Dee, and she explained to me exactly what was happening.
So it is
Yeah, I would advise all women, don't take sweating lightly, because it was one
May
of
not
the
be
first
menopause.
signs.
Yeah. Okay. Yes, ma'am.
Would those guidelines be the same for diabetics? I mean, they always say diabetics have heart problems.
Yes. And in particular with cholesterol and triglycerides, your values have to be much lower because diabetics always advance faster with plaque formation. So the increased amount of sugar in your system increases the laydown of plaque, which is one of the reasons we talk about decreasing our sugars in our diet. And alcohol is a lot of sugar, and so people that drink a lot have more sugar. But diabetics, in particular, for the average individual, just as an example, your cholesterol should be kept under 200, your total. For a diabetic, it should be under 160, which is almost impossible to attain. So most diabetics need to be on some type of medication to help lower cholesterol, in addition to their diabetes medicine.
Sometimes there's no warning at all, like Tom's. We were sitting in the restaurant eating lunch, and thank God for Booker EMS. We were sitting in the restaurant eating lunch, and he fell over dead on me. And if it weren't for Booker EMS, we'd be here today. So there's no warning, he just slumped over. And Booker EMS shocked him and got him back, and Amarillo and Dr. Buell and Dr. Augustini. And he's fine today. That's been 8 years ago.
So is Tom really good about getting annual checkups?
Yes.
Okay.
Oh, yes. His weight, he gained back all the weight he lost, but his checkups and his medications, and he's.
Since the heart attack?
Yeah.
Okay.
And he did lose 100+ pounds,
Okay.
but since then he has got it back. But like I said, his annual visits, and he got the device, and he does the checks with that, and
Good. Good.
I mean, it's, thank you, Jesus.
You bet.
It could have been a whole lot different story.
We saw so often there in Utah that it was like a tradition. Guys would decide they were having a heart attack, so they'd go get the hay in.
First.
Yes. Before they went to the hospital. And it was, heard that, heard it once, I heard it a dozen times. Well, I thought I was having a heart attack, so I figured I'd better get the hay. And, you know, that time counts.
Exactly. So here at OGH, we maintain and update our equipment. We have full lab capabilities here to be able to evaluate for all of the issues from a cardiac standpoint. And we're constantly looking for ways that we can improve our outpatient care here in Perryton, Texas. I don't know anybody here that likes to run Amarillo and back every other week to go to see specialists. That gets pretty wearing after a while. And so what we want to develop here is a state-of-the-art outpatient facility so that we can handle and take care of those needs that people that live here in our community have a need for, as well as Booker and Spearman and closer towns. But OGH is working hard to try and maintain that and improve on that as best as we can. Thank you,
Well, I've
guys.
been watching the progress across the street when you guys went to work here.
Mhm.
And I believe every day since, we've been in Perryton, you're worked every day and we've got a big hospital now. Big improvement. It is,
And to keep up with technology, you have to keep going.
Well-
There's no stopping in that.
you have showed a lot of progress.
Thank you. Any other questions, anybody? Concerns? Comments? Thank you guys very much for being here. I'm sorry. Yes, ma'am.
I was gonna say, they said something about this, when they're up there, about 70 is what the pulse should be. If you have pulse that is in the 90s, or if you have it in the 60s, what a difference is that gonna make?